In today's Health Watch, many of us have been there. The painful burning sensation after eating. It's GERD. It's so short for gastroesophageal reflux disease, better known as acid reflux. It's a chronic condition that affects about 20% of Americans, and that's according to the National Institute of Health, and can sometimes lead to esophageal cancer. So when should people be concerned? Joining me today is Dr. Carlene Chun, a gastroenterologist. We were just saying that's a very long title that you have there.
Very long title.
Yes, thank you for being here. Now, a lot of us have heard of acid reflux, but what exactly is esophageal cancer?
Yeah, absolutely. So April is Esophageal Cancer Awareness Month, so I'm so happy to be here to talk about esophageal cancer. Esophageal cancer is abnormal cell growth in the long muscular tube that connects the mouth and the stomach. And that develops into cancer.
Okay, well, how do we talked about some of the acid reflux things, and how do you know if you, it said we have about 1 in 5 people, so what is a sign of esophageal cancer versus maybe just a normal reflux?
Yeah, absolutely. It's so hard to tell what the symptoms are of esophageal cancer. They're very non-specific, and a lot of times people ignore this. They could be anything from reflux symptoms, where you have a bit of heartburn. It could be trouble swallowing when food feels like it's slow going down when you're swallowing. It could be pain with swallowing or chest pain. It could even be vocal changes where you feel like you have a hoarse voice, or even anemia that's picked up on blood work. And so it's really important that if you have symptoms that you're concerned about, especially if they're new, they're worsening, or you've had them for a really long time, that you come in for evaluation. The other thing I want everyone to know is there's a lot of risk factors that we know about for esophageal cancer. So if you have a family member that has had esophageal cancer, you've had reflux for a long period of time, particularly if you're 50 years of age or older, you're of a Caucasian ethnicity, male gender, you smoke tobacco, drink a lot of alcohol, and then a lot of the lifestyle things, not moving very much, abdominal obesity, all of those are risk factors for esophageal cancer.
Are there things you can do if you have acid reflux or GERD that, I mean, we talked about Prilosec over the counter, but are there things you can do to kind of help alleviate some of those symptoms?
Yeah, absolutely. So there's so many things we can do to treat esophageal reflux disease, but what's most important and what I'm trying to encourage and build awareness is for people to come in and be evaluated if you have symptoms and find out if you have complications from esophageal reflux. So one, yes, there's a lot of medicines out there, a lot of new medicines out there that we can get you feeling better, but we also want to make sure that you've not developed a precancerous condition called Barrett's esophagus or esophageal cancer. So coming in for evaluation is just a good first step.
And what is the Barrett's symptom or condition?
Esophagus.
Yeah.
So Barrett's esophagus, another long word, but essentially it's just cellular changes in the esophagus due to chronic reflux over time, and that's a precancerous condition. So people who have Barrett's esophagus, we want to monitor them closely with regular upper endoscopies every 3 to 5 years, depending on how much of the esophagus is affected, and keep them on an antacid like Prilosec, Nexium to help prevent progression over time.
Awesome. So it's so important to pay attention to these symptoms, because I feel like with stuff like that, we brush it off and just say, oh, we shouldn't eat XYZ anymore.
Yes.
But really, it could be a deeper issue that could be going on inside of us.
100%. And what's really important about esophageal cancer is because of these symptoms, people miss the diagnosis until it's much later, and it can cause significant morbidity and mortality. But if people can come in early for evaluation and we catch it early, we can remove it sometimes without surgery. There's chemotherapy, immunotherapy, surgery that really can give you a much better prognosis.
Awesome. Well, thank you so much for bringing this awareness. I think people don't think about cancer in the esophagus. So
absolutely.
That's why you have the Awareness Month. So thank you so much. We appreciate it. Thanks for being here with us. And you can catch all of our health interviews on our website, cbscolorado.com.